local television network TSPN. And now TSPN proudly presents Today's Seniors Living Well with your host, Laurie Webb.
Hi everyone, welcome back to Today's Seniors Living Well. Our theme this series was Make 2013 Your Lucky Year. And in the last five, today's our sixth and final series of this particular show. We've been discussing all the resources and programs and things in Amador County that can help you make your life lucky by being proactive and taking charge of your health and taking charge of your emotional health. And we've had a lot of really interesting guests, and since we have some really interesting guests this morning, I'm not going to waste time recapping. I'd just like to introduce my first guest, Dr. Karen Pantazis, who is the pain specialist in Amador County. Thank you for joining us this morning.
Laurie, thank you for allowing me to be here.
We're very excited to hear a little about the practice. We've never had a pain specialist before, so how is it you came to Amador County?
Well, I've always really enjoyed the area up here. Amador County is a beautiful area, yes, and I really enjoyed the opportunity to practice in a small rural area. Actually, Ann Platt, who's the administrator of Sutter, we had a conversation, and I had learned of the opportunity here because the area wasn't served with pain management, and especially comprehensive pain management, which is the outlook that I have for helping people with chronic pain.
Is this what you've done most of your career?
Yes, I've been doing this for 30 years. I'm an anesthesiologist, board-certified anesthesiologist, and then I'm board-certified in the subspecialty of pain medicine.
Aha. So there's an actual certification for pain medicine?
There is, and actually there's several boards of pain medicine, the American Board of Pain Medicine, which I have, the American Board of Interventional Pain Medicine, which there's two types of pain management, one having to do with medication management, and the other having to do with injections, spinal injections, epidural steroid injections, those sorts of things. And I do both of those. Not all pain management specialists do that.
So you have a practice that encompasses a wide range of approaches to managing pain.
Yes, yes.
And you use both medication and other kinds of
modalities.
That was the word I was looking for. Thank you. Yeah.
Yes, I do. I believe in the comprehensive approach and in tailoring the pain management treatments to the individual, to their needs, to their particular circumstances, and to the etiology or what is causing their pain. So when a patient is referred to me, I do a comprehensive evaluation for them, and then we decide upon a treatment plan together that will best meet their needs.
That sounds wonderful. Now, of course, Amador County has a large population of seniors, and a lot of seniors, are dealing with chronic and acute pain. But we also have a lot of very active, baby boomers and younger people. So, what kind of patient population are you treating?
I treat all ages, but a good portion of my patients are seniors or soon-to-be seniors, because as we get older, we get more arthritic conditions, back issues, etc., all of which can lead to chronic pain issues. And my purpose is to try to help the individual to lead their best life and in as best a condition as possible with the management of their pain, but also helping people understand that when we get to be 60, we're not 20 anymore, and we can't necessarily do the things that we used to do in the same intensity, frequency, and duration. And so having a conversation about maybe other ways to live their life in the best way possible, but not causing themselves more pain.
More pain, yes.
So it's a learning process.
Yeah, the Buddhists have a saying: pain is going to happen, but suffering is optional.
Exactly.
Yeah.
That's exactly right. That's a motto that I use frequently.
Mhm.
Definitely. It's
Yeah.
it's a lot in the mindset.
Uh-huh.
And changing your mind about things can oftentimes change how you feel about your pain and how well you're able to manage it. So it's more than just about medications and injections, but that is a part of the treatment
A
plan.
component of it, yeah. Do you do acupuncture?
I do not do acupuncture personally, but I think it's a good modality, and there are some good acupuncturists here in town
Oh,
that oftentimes will leave their cards in my office, and if patients wish to go there, I think it's a good idea.
But I think it's wonderful that you have this holistic approach that also encompasses talking to people about their lifestyles.
Yes.
Because as a baby boomer myself, with a husband who's a baby boomer, I see that thing of, damn it, I may be 65, but I ought to be able to hike like I was 45.
Right,
So,
right. And you can still hike, but maybe not quite as long.
Right.
Right.
Have you noticed that there's a common diagnosis or common etiology cause for most of the patients that you see, or is it kind of all over the board?
Well, arthritis is a large etiology. Degenerative discs in the back is very, very frequent, in the neck secondarily. So those are the main problems. Joint pains from arthritic conditions in the shoulders and knees, and then back pain. So I do a lot of injections, like epidural steroid injections, different types of nerve blocks to help with the pain. And they oftentimes are very, very successful. Not everyone is a candidate, but that's part of the evaluation process.
So you assess what the person's kind of physiology and the cause of the pain is, and then between the two of you, you recommend what you think might be the best help.
Exactly.
And for things like that, do clients have to come back periodically and have another injection, or?
Potentially, yes. The injections are not curative, they're treatments, not cures, but very often if a patient can reduce their pain, improve their exercise and their lifestyle choices, stopping smoking, which can cause degenerative discs to get worse and the joints to get worse, then their pain can be improved. But very often they'll continue to come to see me, and we'll alter the treatment plans as necessary for them.
And some people I know with my seniors, particularly the 70 to 100-year-olds, they're very fearful of pain medication. Not so much the shots. People are starting to understand about the shots being helpful, but they don't want to take the Norco. They don't want to take the Percodan. Do you help educate your patients about appropriate use of pain control?
Definitely. Pain medicine is appropriate at times, and there's medicines other than just opioids, which people think of as narcotics, but the medical term is opioid for things like Vicodin, Norco, morphine, those types of things. There's also non-steroidal anti-inflammatories. There are neuropathic pain medicines. There's muscle spasm medicine. So we can have a combination of medicines at smaller doses because each one is doing its job. And then they work together to reduce the pain to a more livable level. And that's an important point. We may not be able to eliminate the pain, but getting the pain to a managing level is our purpose.
So people don't have to focus on their pain anymore. They can
Exactly. They can focus on the
They can
enjoyment.
stop suffering
Exactly.
and go on living.
Exactly.
Yeah.
Yes. Yes.
So besides joint pain, and we all know that our joints and discs are going to probably wear out as we use them. What other kinds of pain issues, like migraines?
Fibromyalgia is one that a lot of women suffer with, especially 50 and older. So that's an etiology or a cause of pain that oftentimes is referred to me, and very frequently that can be a difficult one for to diagnose, because the diagnosis of it isn't through an X-ray or MRI. Headaches, certain types of headaches I will treat. Other types are best treated by the neurologist. But certain types of headaches, like occipital neuralgia, I'm able to do certain nerve blocks in the back of the head, which is the occipital nerve, and that very frequently can help people's pain. Yes.
So that's really good to know that that not only can you identify, like, okay, you have these migraines or whatever, and I can't help you, but you could go to a neurologist and get some additional help.
Exactly.
For those kinds of things.
Exactly. And sometimes orthopedics is the place that the patient needs to go for evaluation of maybe a hip replacement or arthroscopic surgery. So we all work together as physicians to try to get the patient to the best place.
We're so lucky in Amador because,
Definitely.
as limited as our primary care is getting, we really do have some good beneficial specialists.
Yes, wonderful physicians up here. I feel very fortunate to practice in this area. It's a very good medical group.
So if someone wanted to be your patient, if someone felt they could benefit from your services, how would they do that? How would they become part of your practice?
They can be referred by their primary care doctor or another referring doctor like an orthopedic doctor, a neurologist. The doctor's office would send a referral to my office. I review it, and then we would call the patient to contact them to make an appointment. I take all types of insurances,
Medicare,
Medi-Cal, private insurance, and we'll try to get the appointment as soon as possible once the referral is made.
Once the referral is made, so people don't self-refer to your practice.
Exactly.
Okay.
Exactly.
So we're not going to give your phone number out, actually. Now, some of the folks are seeing nurse practitioners because we don't have access. Can you accept referrals from like Patty Sullivan or
Of course,
Marianne?
yes.
Okay,
I get many
great.
referrals from them, and they're
Great.
very good practitioners.
Great. Well, thank you so much for taking time this morning to come and tell us about your practice. And hopefully all of you out there, if you're having a pain issue, will know to speak with your primary care provider and ask them to refer you to Dr. Pantazis' practice. Thank you for being with us today.
Thank you, Laurie. Appreciate it.
Stay tuned. We've got more medical information coming right up.